Hello, and welcome to the Student Experience podcast, where we will be chatting to members of the University of Suffolk community, giving them the opportunity to share their experience with us. I'm Sam, and I'm a member of the Student Experience team, and in today's episode, we're joined by Peter Brown, who is an adult nursing lecturer. We discussed the adult nursing course at the university, Peter's journey to becoming a lecturer, and career opportunities for students after graduating. So, Peter, thanks for joining us today. Would you like to firstly introduce yourself?
Thank you very much. Yeah, my name is Peter Brown. I am a senior lecturer in adult nursing at the University of Suffolk. And when people ask me what I do for a living, I never know really what to say because I am a lecturer and an academic. But first and foremost, I'm a nurse, and that's where my heart is in nursing.
Yeah. So, if you could sort of maybe go through an overview of the adult nursing course for listeners to sort of hear about what the course is all about.
Yeah, sure. So adult nursing is a 3-year course, undergraduate course, Bachelor of Science degree with honours. And it's a very, very tough course. And I'm not trying to put people off because that's not the aim for today. But I think we've got to acknowledge that it is a real challenge to successfully complete this course because it's a course that's grounded with 50% of theory. So the students spend half their time on campus with us, working through lectures, seminars, simulation, different types of exams. And then at the same time, they've got 50% in practice. So it's a tough course because you might be, for example, I've got some third-year students now who are doing their dissertation, which is a literature review and requires a good understanding of academic practice and research. And at the same time, they're out there in clinical practice working in the hospital, in the community, in prisons, in hospices, caring for people. And that brings an extra challenge to university life, for sure. So it is a tough course, but it's ever so rewarding as well. And that's what our graduates tell us, is that they've never regretted once doing their nursing degree. If we think about what we do here on campus at the University of Suffolk, we have this block and blend approach, which I know the university is a pioneer with, which means that they'll have one module at a time and then an assessment and then move on to the next module. So it starts off in the very first year with an introduction to professional values. Nurses have fought very hard for nursing to become a profession, a registered profession over the years. I mean, if you look at the history of nursing right the way back through the ages, it would have been someone that would have just taken care of other people. And today, where we have the Nursing and Midwifery Council who regulate the profession. So we introduced the concept of professionalism to start with. And then we work through kind of a trajectory of academia around healthcare across the 3 years. So when we start with that first year in what is a professional nurse, halfway through the year, we've got a module that looks at deteriorating patients and care of acutely unwell adults. This is adult nursing that I'm talking about. And this is nurses who work in, like I've mentioned, a variety of settings, caring for patients that are at risk of suddenly becoming seriously ill and being able to do things that they couldn't have even done 2 or 3 years ago because of changes in practice and expectations in practice. So we teach that in the second year and how to systematically assess and intervene in a patient that's suddenly deteriorating, right the way through to their final module, which is their dissertation, which I've just spoken about, which is over to the student to choose any subject they like, as long as it's relevant to nursing, and then see what the evidence is around that and produce some implications for practice. And we've had some really fantastic dissertations recently where students have actually gone and taken their dissertation to their new employers and made those changes in the NHS.
That's brilliant.
So quite a lot of detail there about what's involved in the course, but in summary, it's tough, exciting, and grounded both in theory and practice.
That's perfect. So you mentioned there about the fact that it's 50% theory, 50% on practice. Could you sort of chat a bit about how that works in terms of the integration of the course? Yeah. Where they go in, what they doing?
Absolutely. And one of the best things about nursing is that, I mean, if I was to say to you, what is a nurse? I don't know what you would say.
Yeah, I guess I feel like it would be someone that has to do a lot of different things and juggle a lot of different things.
Yeah, there is a lot of juggling going on, metaphorically speaking, that's for sure. But it's a very difficult question to answer. And there's like a historical debate in nursing. Is it an art or is it a science? And it's a bit of both, you know. So the student nurses that go out into practice will see or should see the full range of nursing care. That's what the NMC say. But that also means that they could expect to be in placement somewhere in the community. They could be right out in, the middle of the countryside. I've got a very rural location here in Suffolk, so they might find themselves based in a community setting near Aldborough or right the other side of the county, or they could find themselves in the major trauma centre at Addenbrooke's. What to expect? They'll come in, they'll do a block of theory, like I mentioned, that introducing professional values module, and then there'll be another module in the first year, and then they'll go out into practice for a short placement. I think it's 4 weeks to start with.
Okay.
In the second year, there's a little bit more blocks of placement. And by the time the third year comes along, it's more placement than it is theory. So we have less time on campus and more time in practice when that third year turns up. And the final placement is a 12-week management placement where the student nurse is learning how to lead and manage care. So it's similar to the theory. It's got that step-ladder approach of a gentle start, introduction, the foundations of practice, moving forward to the final year, where you have a student nurse leading and managing care under supervision in practice. And like I say, that could be anywhere. We've had students that have recently qualified working in the community setting, working in the hospice, in intensive care. Like I say, what is a nurse? Is it someone that supports someone when they're dying? Yeah. Someone that provides that resuscitation? Someone that does those sort of interventions in assessing someone initially? Or someone that just is there for someone in their time of need. It could be any of those things. And that's what the course sort of reflects.
Yeah, so in terms of, I guess, from level 4 through to level 6, when they're on placement, they'll get more and more responsibilities. Yeah. So,
and it depends like what the student has done in the past as well, because, we have students that come from a range of different backgrounds and experiences, and some have different life experiences, work experience. So you might have someone that has never worked in healthcare, but comes in with a completely different perspective and completely radicalises the way an area does something. They'll be supported slightly differently, perhaps, to someone that has been maybe a healthcare assistant or a nursing apprentice or associate for some years beforehand, and has got that clinical experience, because they might have, sort of an expectation of how things work. So it does depend on the individual student, but you're right, they are well supported in practice. We have quite a good working relationship with our partners as well. I still work in practice, so sometimes bump into students in the hospital. And we have practice partners who are educators, registered healthcare professionals, mainly nurses that work in the hospital 24/7 and are there for our students there too.
And you mentioned there about the diversity of the students. I guess for them, maybe a student that's just come out of university can learn a lot from a student that's been out in practice before, and vice versa. So it's a great opportunity.
Absolutely, yeah. It's that two-way, it's that dual relationship, isn't it? So, I remember I did a shift at a hospital last year, and there was a healthcare assistant who was brand new to the ward, but she was a retired primary school teacher, and she'd always wanted to be a nurse, and she decided that she's going to go into what used to be called auxiliary nursing, so in a sort of a non-registered healthcare role. Just to see the way that she approached things differently to one that maybe been there for years and years and years was really nice to see. And I learned a lot from her that day as well, the way she was with the patients, the way she communicated things. It's not always the technical skills. That's the stuff that maybe brings people into nursing in the first place, the acquisition of new skill to sort of care for people and save lives, but the soft skills as well, the situational awareness, communication, the caring, the compassion. You can learn so much from our students as well as them learning during the course.
Yeah, absolutely. And so I know that the health and wellbeing is sort of a really good facility that the university has. So, could you chat a bit about maybe the facilities that we have available
I certainly
to
can.
students?
Yes, that is certainly one of the main selling points in terms of the environment we have at the University of Suffolk. We've got a health and wellbeing building, which, if you start on the ground floor, it's got an access centre for patients. So real patients come in and they see, at the moment, they've got a physiotherapy clinic that's working there. Also on the ground floor, we have our immersive suites, which is kind of becoming a, what do you call it, kind of a gold standard of simulation, which is where you'd have a room that's got projectors on the walls, and you can set up any environment in that. It could be, for example, for our paramedic colleagues, at the roadside, you could have a car crash that's happened, and then it's up to you how you dress that set with debris and some mannequins or some actors, and then you can ask the students to step into that scenario, role play what would happen through simulation, and then I think the best feature about that room is the size of it, because you can at any point pause the simulation, step away and say, what went well there? What didn't go so well? What would we do differently next time? And then go back into the simulation. So that in-action simulation is something that not a lot of universities use, from what I've seen out in academic practice, and a really sort of good selling point, I think, for our course. We also have working X-ray department and imaging suite, and then on the first floor is where we have our nursing skills labs, which is where I spend most of my teaching time in simulation. We've got 2 adult nursing wards. I'm just going to count the beds: 1, 2, 3, 4, 5. I think there's 6 beds in each ward, and we have different grade mannequins on there. And if you're a bit of a simulation bore like I am, you can get very interested in the type of mannequin you've got and how much they cost and all the things they do. But essentially, these are mid to high fidelity mannequins produced by a company called Laerdal that you might have heard of before. And they produce those resuscitation mannequins that are used all up and down the country. But these mannequins will talk to you. They will blink, they will bleed, they will pee, they will scream, and you can use this again for those technical skills. So we could maybe put an intravenous catheter into one of these mannequins. We could put a urinary catheter in. You can intubate the patient, take their blood pressure, feel their pulse, and they have a very realistic radial and carotid pulse. And again, when you're creating a learning environment of a patient perhaps deteriorating, having that element to it, that sort of buying into the simulation and having a mannequin that can do that, and you can set up more than one at a time, so you have a sort of a quasi ward set up for the students, creates other learning opportunities. So we've got 2 of those wards, and in the middle of those wards is a viewing platform. So we can actually set up a scenario and sit inside that viewing platform through a 2-way mirror and observe students how they might follow a certain scenario. We've also got a community flat, so nursing doesn't just happen in the hospital, as much as I might like to think it does sometimes. Community nursing is the future of nursing, really proactive healthcare in the community. So the community flat does lend itself to that. And that's a little self-contained apartment that we can, again, set up individual scenarios for. And we also have a birthing suite, which I don't know anything about midwifery. I'll get a bit scared when I walk past there. And also a child nursing ward as well. And if I just do a little selling point for some of my teaching that I do with the nursing course, so this is the undergraduate nursing course, and this is also for physiotherapy students and radiography students at the University of Suffolk. We are the only university, as far as I'm aware, in the country to offer an enhanced resuscitation training programme for those undergraduate students. Most students at different universities, and this was certainly my experience as a student nurse, will go into university for their basic life support training to get into practice, and that might be like an hour's session where they'll have a mannequin on the floor, one of those little torsos that I mentioned, and they'll say, okay, do a few chest compressions and you're done, and you'll do those chest compressions and you're signed off. We don't do that here at the University of Suffolk anymore. We have a 3-year programme, so we have 2 days out of each academic year to focus on improving resuscitation practice. I'm an instructor with the Resus Council, and I'm quite passionate about this because survival rates are very low, and if you look at the evidence, that's sometimes down to the education not being up to scratch. So in the first year, we have a basic life support day where we talk about how we can optimise our practice. In the second year, we do like an enhanced life support training. And then when the third year comes along, it's something closer to ILS, which is a step up beyond BLS. And I'm very pleased to say that the students enjoy it. It can be a bit scary at times, but they really enjoy it. They find that it really impacts their practice. Yeah. And to my knowledge, directly from that, the feedback that I've had about 3 or 4 lives saved as a direct result.
Wow, that's brilliant.
that's good news all round.
Yeah, so I mean, the facilities just sound like amazing.
They are.
I guess. I mean, probably a lot of people might just think that a mannequin is a mannequin. Like, there's not different types. So
absolutely, there are lots of different types. And I know I mentioned the cost earlier, not to go on about it, but I know we've got different ones that vary in cost. Some £30,000, some £60,000, depending on what they can do. But the main thing is they add to the learning and that experience, that learning experience that you're having on campus.
That must prepare them so well for practice as well.
I think so, especially those perhaps that have never been in practice and haven't got that experience. That's certainly something that would enhance their preparation for that first shift as a student nurse.
So we mentioned a lot about the facilities and the resuscitation options that are available at the university. So is there anything else that would maybe encourage students to come to this university to study adult nursing as opposed to others? I know maybe we have a smaller cohort, so maybe you get to know the students more personally.
Yeah, I mean, I think I said to start with when I was introducing myself that I would say that I'm a nurse first and not a lecturer, and I'm certainly not a salesperson for the University of Suffolk, but I do love working here.
Yeah.
And if anyone is interested in nursing, my advice would be to go and have a look around and see which university suits you and make that right choice for you. And the reason for that is that the curriculum for nursing is set out by the Nursing and Midwifery Council. So if you wanted to go to Edinburgh or Nottingham or UEA or Suffolk, you would likely follow a similar, very, very similar curriculum. But you're right in what you're saying. We were talking just before we started this about your time as a student here as well. And I don't know if this is your experience, but from me being a student at a different university when I was an undergraduate and then as a postgraduate, and my experience as an academic here, we are smaller. I don't know what's going to happen when we take over the world and we become the biggest university ever, but we are smaller. And I think the fact that we have a very friendly atmosphere in and amongst the nursing team, I don't know if that's due to our profession or if that's because that's part of the University of Suffolk's values, probably a bit of both, means that we build up, I think, very good relationships with our students. I've just taken on course leadership of our first year students, and I know most of them all by name from that cohort, and I'm pleased to say they feel comfortable to come to me if they've got any problems. And we normally know, if their cat's got sick or something, and they've got the car doesn't start, and we can sort little problems out like that, which wasn't my experience as a student at other universities. So I think on top of the facilities, our a sort of general approach to support to get you through, to get you achieve your goal of qualifying as a registered nurse is something that is setting us apart at the moment.
Yeah, no, 100%. Certainly, I agree with that from my time as I was a student here, because I know we've had some people, like on the podcast, for example, that have said that at other courses, other universities, with the course that they're studying, there might be 300-400 students.
Yeah.
And you're never going to get to know the lecturer very well doing that.
No, not at all.
No. So, we mentioned a bit about sort of what you can offer the students in terms of, them sort of personally, say something's wrong with their cat. So you chat a bit about maybe some of the other support facilities that are available to the students. I know we have like personal academic coaches, and the library team have some good
definitely
support as well.
That's something we mention when students, if they're thinking of coming to the University of Suffolk and they're not too sure, and they come to one of our open days or they come to the interview for adult nursing, and we talk about the support, that is normally what convinces them, because there is an authenticity in that. So other universities, sometimes students need a specific maybe learning need or adjustment to access further support services, like our academic skills advisors here. At the University of Suffolk, anyone that wants to make an appointment with them can have that. And I take advantage of that too. So I'll book myself in with one of my academic skills colleagues if I'm having to write an article or look at some research or something that doesn't quite compute. And they're excellent at breaking it down and supporting you. So all of our students have access to that extra service. You're assigned a personal academic coach. That was the pack that you mentioned, which is essentially old-fashioned personal tutor, and they stay with you for your whole course. So I've been here for nearly 7 years, and so 3-year degree. I'm on to my fourth run of packs now. Third run of packs.
Yeah.
So, and I've got to know those students really well, and I see them out in practice, which is nice. So that's really, really good. You also have support from a module team, because we have individual modules, obviously, that I've mentioned, that our lecturers and my colleagues will teach to their strengths. So, for example, I was mentioning resuscitation. I'm particularly interested in that and have experience in that, so I teach in that area. I've got a colleague, Dr. Heather Shaw, who's just running the professional values module, and that's her special area of expertise as well. So having that dynamic where you've got a module team with a module tutor that you can go to, as well as the academic skills, as well as the pack, you shouldn't be wanting for support at the University of Suffolk. And then when you go out into practice, you've obviously got your practice education facilitators employed by the Trust, who work closely with us, and a link lecturer. So I'm the link lecturer for what's called Suffolk Rural, which is a group of GP practices and community practices in the middle of Suffolk. But we have link lecturers to all our local partner trusts. So if you have any issues, you can go to your practice supervisor, which will be the nurse you're working with, practice assessor, who's the nurse that will be assessing you at the end of your placement, your practice education facilitator, your link lecturer, your PAC. So there's lots of support there for them.
Yeah, that's brilliant to hear. So if we sort of move on and look at when students graduate, and in terms of adult nursing is quite broad and there's lots of different opportunities for students to go into, maybe if you could sort of give a list of different areas that students have gone into after they've graduated.
Yeah, it makes me laugh, actually. I once did a radio interview when I sort of first started at the university for a local radio station. And I said that, our employability is something, I think our students find employment, I think I said like 98% locally, right, and then 5% internationally, and obviously that would be more than 100%. So I made a real error there. But basically, it's 100%. We've got 100% employment rates from our students. And I mean, you can make of that what you like. You might think, well, the NHS is understaffed, which it is. But the fact that gives you a little bit of choice as well. I'm just thinking about we had our graduation ceremony recently here on campus, and some of the people that I saw collect their awards are out doing a whole range of different things. There's one student or now registered nurse who is already a leader of a care provider, Care UK locally, working with older patients in the community to provide quality care. There's a nurse who is a resuscitation officer, and that's their special scope of practice. We've got a graduate who has gone to work in children's nursing in paediatrics, one that is already doing their shortened course into midwifery because their goal was to be a midwife. One that is working in a sort of the charitable sector, and they're going to be going abroad soon to be doing some nursing overseas. And lots of nurses that are working in their speciality of choice, either in the hospital, in surgery, in medicine, in acute care, in end-of-life care. So there's 100% employability, normally in your role of choice as well, which is something that you can't really say for many other professions. That's
great to hear. So if if there's potential students that are listening to this podcast and they like the sound of it, sounds really excited to them, have you got any advice to them when they're submitting their applications?
I would say come here, definitely, and have a look around and see what you think of the place, because you might think Ipswich, University of Suffolk, is that really what I want? Is that experience I want? But I think once you've come to see what's on offer, that is our best, the way of making that decision is to actually see what's here, and probably quite surprising in a sense. In terms of advice for applications, that comment that we made earlier about what is a nurse, see if you can try and answer that in your application, because I think the NMC's definition of what a nurse is that they're an advocate for the patient.
Okay.
It doesn't mention cannulas or catheters or drips or drugs in that sort of immediate definition. It mentions someone that is there to care for someone else. Most people might think they want to be a nurse for sort of one reason or another. The students that we have and the applicants that we see, it's normally ones that have had some personal experience. Either a family member has been unwell, they've witnessed something, they've seen something in practice that maybe they weren't even too sure about. They thought that wasn't good and they want to be better. It's convinced them that this career is right for them. So in their application, talk about what's inspired you into nursing. Look at what the NMC say nursing is and bring that into it. And then think about what you can give to the course as well, what you bring to the course in terms of your your individualism as a nurse. How would you want your patients to describe you?
That sounds like some really good advice. So you mentioned coming to an open day. Students might come to an open day and look at the facilities and talk to the lecturers. Sort of what are some of the key questions that students tend to ask at open days, and maybe the answers that you give?
Some of the questions are about night shifts, because that seems to scare lots of students. Some of the questions are about exams and essays and what to expect. And we also get questions about placement. So I can run through some of those if you'd like me to. Night shifts is a yes. But nursing doesn't stop. It's 24 hour a day, 365 days a year. And we would expect, and the Nursing Midwifery Council would expect, that someone, when they graduate as a nurse, has got experience of seeing that full 24-hour cycle of care, because things are different overnight, and things do change. And it changes for you as well. If you try and work a 12-hour night shift, you do things slightly differently. It's not easy, particularly. There is. Don't worry, you won't be on night shift every day, or every night, I should say. But there is a requirement that at some point over the 3 years, you'll be doing some night shifts. We recognise that a lot of students, they have children, families, their own lives, things going on. But as part of that support that we offer, we can work out a plan that will hopefully work for the student in terms of those shifts. I think I mentioned was like exams and essays, and students do get a bit anxious about that. And this sort of maybe goes back to the whole is nursing an art or a science conversation. The first thing that you'll do in terms of an assessment at the university is to submit 500 words to your personal tutor, your PAC. And the whole point of that is really not to, be thrown under the bus and say this isn't very good, or this is the best piece of work ever, how amazing. It's just to get you just to start nicely, and as a diagnostic tool. Sometimes people have gone through their whole sort of education life and had dyslexia and never known it. So we can pick that up in that first 500 words and get some support and some plans in place for successful completion of the course. And I've really seen that over my time here at UOS. So there are some essays that you'll have to write, and a lot of these are based on clinical events, like a case study. We might ask you to identify a patient from practice and evaluate the care that you have seen, and that's like a benchmark of academic practice in healthcare. So at medical school, student doctors will be doing the same kind of thing, midwives, paramedics, nurses, and that's because it shows that you're able to look at the evidence around the care that was received, evaluate it, and make a judgment call. Why was it good, and what could have been done better? We also have some written physiology exams and pathophysiology when body systems start to deteriorate. And then we have something called an OSCE. I don't know if you've heard of it.
I've heard of it, yeah.
OSCE, it stands for Objective Structured Clinical Assessment or Exam. And this is an exam, but it's an exam by demonstration. So in those skills labs that we were talking about, a student would go into one of those mannequins and maybe have to perform an assessment on the patient, like a systematic assessment. In the first year, that's all they might have to do. In the second year, they might have to perform the assessment, and the mannequin then might deteriorate. So without giving too much away. So then you have to reassess the patient and make appropriate interventions as needed. And in the final year, we have a viva voce, which sounds quite daunting, but that's essentially an oral presentation for the students, and their dissertation, which is their thesis, their pièce de résistance. So they can write that on anything they see fit. I've read some really interesting dissertations ranging from Nigerian student nurses' experience in the UK to how do we improve the uptake of cervical screening for young women as far as cancer detection is concerned. There's just two that have come to mind there. And the other thing that we mentioned that the questions get asked about is location for placement. Okay. So you'll be able to choose a base site. Like I say, we have a good working relationship with our partners, but because of the nature of where we are in the UK, it is quite a large rural area. So let's say, for example, you've chosen Addenbrooke's as your main base site because you want to work at Addenbrooke's Hospital and you want to learn at Addenbrooke's Hospital. Be aware that they might send you to Newmarket or to Brandon or somewhere, very rural for your community placement, because that sits in that same geographical area for as far as the placements are concerned. But we've got a choice of around 1, 2, 3, 4, 5, 6 different main hospitals in the area, so we're quite well placed for that. And you'll be on placement with fellow University of Suffolk students, Anglia Ruskin UEA students, Essex students, some students from London universities attend here to see district general hospitals in East Anglia as well. So, so you'll get a base site that you'll be able to choose, and your first choice is likely to be considered as basically given to you. And then you'll have a community placement and some other placements in and around that. And that could be prison nursing, could be hospice nursing. We even have a care farm, we would do in Suffolk, wouldn't we, that some student nurses go to. Yeah. It could be community nursing, district nursing, GP practice, clinics. So there's a whole range of things that are available there.
That's really, really helpful for those that are listening. So if we look at maybe a student that's applied for the nursing course, they've got their place secured for September. Have you got any advice for them sort of as they prepare to join the university?
That they should be probably thinking about what kind of reading they're doing. Mm-hmm. And it's always good to brush up on some anatomy and physiology. That first module, like I say, is about professionalism and professional value. So maybe review some of what the NMC standards for proficiency are, because they're the proficiencies that they'll have to achieve to qualify as a nurse. These are a whole range of things from, taking a blood pressure to managing a dying person or supporting the family or communicating bad news, or it could be even something like going through and taking a pulse of a patient. So having a look at the NMC standards for proficiency for pre-registration nursing education is one thing. That's a bit of a mouthful. And the other thing is to look at some anatomy and physiology. There are lots of good resources, though. The Khan Academy, YouTube videos. There is lots of good podcasts from the BBC around sort of healthcare. I was listening to the food programme on Radio 4 the other day, where a nurse has set up a clinic in a barber shop in London, and she's doing sort of like screening for diabetes in the Afro-Caribbean community there, because they wouldn't normally go to a nurse, to a GP centre. And things like that, thinking about sort of nursing outside the box, what really makes person-centred care? We might talk about that in nursing a lot. What really makes holistic care? And those sorts of resources, like something you might find on a podcast, you can do a quick search on the BBC or on Spotify or whatever and find those would be one way of preparing. Yeah. But yeah, NMC, looking at the proficiencies and some good anatomy and physiology provision.
That's great. So in terms of once students have started the course, mm-hmm. have you got any advice for those to get the most out of their course, maybe more extra in terms of what the course, the actual theory and the actual practice, maybe some extra advice for them to get the most out of it?
Yeah, I think engagement is key. Nursing isn't like any other subject. If we were doing, and you might have a history academic here next, so I won't say anything too disrespectful, but if you had a history student and they were to miss a lecture, that's a problem. But if a student nurse isn't engaging with a lecture, then that is a worry, because mm-hmm. you don't want to miss anything that could one day impact that patient. So engagement is really important, and to do that, we have our Brightspace, which is our learning portal, and look at the reading list. So in your self-directed study days and your online learning, have a look at what is on that reading list, and just pick a few things to have a read through and look at. Always be critical, keep asking questions and keep challenging, because we want you to be critical, evidence-based practitioners. I like it when someone challenges me in the lecture theatre. It might make me feel a bit awkward and embarrassed at the time, but it forces me to go back and look at the evidence and look at the research. And there's a whole load of things that are sort of up for discussion at the moment. We've had people, talking about vaccine injuries, and sort of the safety around that, and conspiracy theory, and then we've moved on from that into different types of preventative healthcare, and sort of like a post-pandemic model of access to healthcare and crisis and finding a GP appointment. There's lots of discussion to be had, and the university is a place to have that. So keep asking questions in class, keep being critical, and engagement.
Perfect. So just quickly, before we move on to have a little bit of a chat about yourself and your role and your background, is there anything else you wanted to mention about the course or about the university generally?
I think that the fact that, you've got to really want to be a nurse. So what we're seeing is applicants are applying because they've really thought about what their career options are. They're not doing it because they've got nothing else to do. So if you've made that decision that nursing is for you, I would say to have a look online at all the different providers out there for education, and come to the University of Suffolk and have a little look at our facilities. Come and meet my colleagues, see what our expectations are, and see if what we have here meets your expectations. And because of my experience as a member of staff here, and what I've seen of our student experiences both in practice and on campus over the last 7 years I've been here, I think that you'll be really impressed and warmly welcomed here to UOS.
That's great. So as I say, now if we have a quick chat about your journey at the university. So
we don't want to bore anyone too.
So why did you want to become a lecturer and move away, as well as
That's a really
practice?
good question, actually. Yeah, most people say, why did you want to become a nurse? And like I say, I think of myself really as a nurse. Yeah. But I have been here for 7 years, and I think for me it was kind of by osmosis. So I was working in clinical practice, and I was finding my feet, first of all, in acute care, in an admissions ward, busy admissions ward in a general hospital. And then I started to work in emergency care. And then I did some training around resuscitation myself, and I really enjoyed it. And at the end of the training session, one of the instructors said, "Peter, do you fancy going to do your instructor's qualification?" Which I thought would be great. So I went off to the North Mid in Tottenham, hospital in London, and did some training to become an instructor. And I loved it. I liked being tested in the classroom. They do take simulation to the next level, because they were sort of pushing out the way and being, cantankerous students and playing the role of a obstructive consultant who knows best. And I had to try and manage that as a facilitator. And thankfully I passed that course. And I started to do some instruction on resus alongside my full-time clinical role. And then I just saw that a job was advertised at the university in teaching sort of clinical skills. And I thought that would be a nice accompaniment to my practice out there, working the shifts as a registered nurse on the shop floor, if you like. When I applied for the job, they offered me the job as a lecturer. So that was a bit of a surprise to me. Yeah. Well, actually, they phoned and said, "Thank you very much for your interview. It's a very good interview. We'd like to offer you the job, but we're not sure what that is yet." And I didn't know what that was going to be. Was it going to be, holding the door open in the morning for someone, or, car valet? But no, it was lecturer. So I had some thinking to do, because I knew that if I was to take this full-time role as a lecturer, I would have to step down on my time in clinical practice. Mm-hmm. But I thought the opportunity to work with aspirant nurses and a change of environment for myself, and to work with students, and having been inspired by my nurse lecturer as a student, I thought it was too good an opportunity to turn down. So I came as a lecturer, and now here I am as one of the course leads of the programme.
That's brilliant. And throughout this podcast, we can really hear the passion you have for your course and nursing generally. So have you got a particular favourite part about being a lecturer at the university?
I really, it is the I can see what I hate, which is the emails or the administration. But what I love, it really is the students, and it's seeing this. I mean, like I said, the graduation ceremony. I didn't even go to my graduation ceremony when I finished my MSc in nursing. I thought that ceremony wasn't that interesting, and I wasn't in it for that, and I was in it just to become a nurse, and that was fine. But seeing the change in a person from when they come and they want to be a nurse to leaving and they are an actual nurse, and you would, trust them into the care, your family into their care. That's quite special. There's not many feelings other than when in practice and a patient says thank you. That's very nice. Or in practice and you've gone through an emotional journey with the patient. That is very rewarding. But this is equally rewarding because I know that student's going to go and impact someone's life like that as well. So yeah, I know that sounds a bit glib, but no, it really is the best thing about the job is to see those students coming in from one position, leaving with another, and knowing the impacts they're going to have. And I've been a very small part of that process.
Yeah. So just before we move on to the final question, it would be interesting to ask you if you've got a moment that you've, as your time as lecturer, that you're most proud of. Is there anything that stands out in your mind?
I'm proud of my sort of students. Really, that's the thing that really. I know. Again, it sounds really glib, doesn't it? But I'm really proud of what I've seen, changing my expectations and challenging my bias, my perception, thinking that I don't think this student's going to make it, or I don't know if they've got what it takes, and being proved completely wrong by their ability and their resilience and their commitment to nursing. Two things other than that stick in mind just for me. Very briefly, there was the nursing workforce took industrial action a year or so ago, and I was very pleased to support the students that are affected by that, and to try and encourage some change for future nurses. And the other thing as well is that I went back into practice still as a lecturer, but working as a nurse during the COVID pandemic in the first wave. I went to intensive care at Ipswich Hospital, and I worked with 2 graduate nurses who I'd literally just worked with them through their 3 years of training, and there I was working alongside them in intensive care, and we'd seen all those images on the news of overflowing intensive care departments and patients on ventilators and personal protective equipment, and there I was working in that as a novice. Really, I'd had 2 days worth of training. I'm not an ITU nurse by background, and there were students that I'd worked with and taught and supported who were supporting me looking after those patients. And I received a letter a few months afterwards, after the first wave had finished and things were starting to open back up again, from one of the consultants there, thanking me for the efforts. And that made me feel quite proud that I'd done that, but I'd also was proud that the students that I'd worked with were there helping me, if you know what I mean.
Yeah. So yeah, that's really interesting, that conversation we've had. I'm sure those that are listening have learnt a lot, and hopefully maybe they might come to an open day or reach out to apply to the course as a result. So a tradition we have on the podcast is we have our final question is our answer one, ask one question. So you're going to answer a question from previous guest, and then you're going to pose one to the next guest.
Okay. Thanks for the heads up.
So the question we got from the previous guest is: if you look back at your time at university and on your first day at university, have you got any advice that you'd give to yourself now, knowing what you know now?
As a academic, as a lecturer, when I first started here at the university as a member of staff, it's a really good question. I don't know who your previous guest was, but that's a really good question. I think if I was going to give myself some advice, the first thing would be not to spend so much money in the coffee shop. The second thing would be to not put so much pressure on yourself, because the support mechanisms that we have at the university in terms of my line manager and the support mechanisms we have for the students work. And I've felt, maybe I'm very lucky, but I have felt supported by my dean of school, by my line manager consistently throughout. And in the first few months, I was not knowing which way was up. I was answering emails at 2:00 in the morning and panicking about teaching and things. Yeah. And looking back, I didn't need to do any of that, because I could have gone to them for support, but I didn't really do it at the time, because I wanted to prove to them that I could do the job. So yeah, that would be my advice, is to just take your foot off the pedal a little bit.
Okay.
Seek support more readily, and don't spend so much money in the coffee shop.
That sounds like some good, solid advice. So have you got a question for the next guest that you can think of?
It would be a bit too narrow if I asked them what their favourite Bruce Springsteen song was. So I'd probably ask them a question that is difficult to answer, and it depends on who your guest is. I don't know if I can ask two, and you can choose which one you want to ask. First one, which is where would they see themselves 5 years from now?
Okay.
And I'd be interested to see if they see themselves still working at the university, or if they see a change in career, maybe further study, or if they've already got their doctorate, if they're thinking about how they might use that research that they've done. And the other question would be if they could work with anyone to enhance their field of practice, who would that be? So for me, I might be thinking of some nursing heroes, or some statisticians, or some people in healthcare. But for them, that might be someone completely different. If those questions fail, what's their favourite Bruce Springsteen?
Okay, yeah, I think that be. Look forward to asking those questions to the next guest. So yeah, thanks again for joining us today, Peter. So
No problem at all.
until next time, it's goodbye from Peter.
Thank you very much. Goodbye, everyone. Thank you.
It's goodbye from me. Goodbye. Thank you for listening to the Student Experience podcast. If you would like to be a future guest, email studentexperienceteam@uos.ac.uk or follow the links to our application form through our Brightspace page. You can also reach out to us through our Instagram page @UOS_student experience.